Good evening, I'm Adrienne Arsenault.
And I'm Andrew Chang. Tonight, the arc of COVID causes new concern for some hospitals.
Sadly, there'll be more people dying.
Plus, getting up to date on Canada's cases.
AHS can't achieve savings without changes to its workforce.
Alberta's new messaging on healthcare cuts.
There are ways to actually manage this.
Halloween could be a go. We'll tell you how.
And from coaching in a bubble to wearing glasses he doesn't need.
We wore them for my mom.
A virtual shoot-around with Nick Nurse. This is The National. We have seen the second wave of COVID-19 washing over parts of the country, watching case counts rise. And now officials are starting to see early signs of strain on hospitals.
And the post-holiday warning from Ottawa is that the system can only do so much.
This is the time to double down on our efforts to stop the spread.
We're all suffering from COVID fatigue, and we're now coming into our winter, I'll be the first to say it, hey, winter is coming.
The public health system and capacity is not limitless, so people still have to do their part.
A month ago, Canada was detecting around 700 new cases a day. Now, it's more like 2,200 a day. And COVID patients are now starting to fill hospital beds. They occupied around 270 beds across Canada a month ago. Now it's more than 900.
Overall, hospitals did face a bigger crush at the height of the first wave, but patients just keep coming. And as Olivia Stefanovic reminds us, some of them are already on the verge of being overwhelmed.
For the healthcare workers, it's another stress. It's another load on their shoulders.
COVID-19 hospitalizations in Ottawa have tripled in 3 weeks. Canada's capital is now a red zone, the only region in Ontario currently under that designation.
There will be more people hospitalized, there will be more people in intensive care, and sadly, there'll be more people dying.
Ottawa Public Health rang the alarm bell days ago, warning the healthcare system would be crushed under the weight of rising infections.
Ottawa's health system crisis will only get worse.
And it's not alone. Other Ontario hotspots are also seeing hospitalizations near capacity.
My real worry is that there'll be significant disruption to those types of surgical activities. They're called elective, but the name betrays an absence of true meaning.
Health officials fear the spike in the spread of the virus will create a domino effect, adding important non-COVID procedures to a backlog left over from the first wave.
If we don't get these numbers under control, we'll get numbers that the hospital can't handle.
We need to have room for the people in case they have to end up in the hospital.
On Friday, Ontario introduced new restrictions in Ottawa, Toronto, and Peel, and came under fire for not moving sooner.
So many armchair quarterbacks that can sit back and haven't walked a mile in our shoes, and it's easy to say could have, should have.
Medical experts say Ontario is at a tipping point, and the gravity of what hospitals are facing is not yet clear. Since it takes time for symptoms to appear and develop, the number and severity of post-Thanksgiving cases won't be known for weeks. Olivia Stefanovic, CBC News, Ottawa.
Manitoba announced its highest number of daily new cases today, and the province's top doctor says infections are happening in multiple age groups and settings.
What we're seeing here is increasing community-based transmission, which makes it very difficult to take a very targeted approach.
Newly reported cases in Manitoba have rocketed to an average of nearly 80 a day. That is a lot for a province with less than a tenth of Ontario's population. And by population, new cases in Manitoba just overtook Ontario for the second worst COVID-19 epidemic in Canada. Quebec is still far ahead in first place. But there is some good news in Quebec's numbers. It announced restrictions in red zones 2 weeks ago. And while it may be a coincidence, case rates started leveling off shortly afterwards. For the past few days, they've actually been declining. Now, relatively speaking, 6 new infections in a province seems low. But as Kayla Hounsel tells us, 82 active cases in New Brunswick has some worried about the Atlantic bubble.
For now, traffic is flowing over the Nova Scotia-New Brunswick border, but COVID outbreaks in New Brunswick have some wondering whether the Atlantic bubble might be about to burst.
I've kind of been expecting that to happen, but I hope it doesn't.
I would never want to go to New Brunswick until you're absolutely sure it's safe.
But many in the border town of Amherst, Nova Scotia have to travel back and forth for work. Even the town's mayor is also a doctor in Moncton, where there is an outbreak.
I am kind of self-imposing the limitations that I had when they actually had the closed border. I, as an essential worker, could cross and go to work, but I was not allowed to do anything in New Brunswick besides that.
Today, New Brunswick is reporting 6 new cases. The province has increased restrictions in affected areas, requiring masks in indoor and outdoor public spaces.
We're throwing everything, including the kitchen sink, at this, and we don't have a choice because we are a small province and we really have to protect our human resources and we really have to protect our hospital services.
Nova Scotia, Prince Edward Island, and Newfoundland and Labrador are all reporting 0 new cases, and that is raising questions about whether the bubble should at least shrink.
I'm not talking about closing a border today, and I mean, really, we want to maintain that Atlantic bubble as much as possible.
It's a great reminder to all of us to continue to be vigilant, wear our masks, make sure we wash our hands, keep our distance, and we can continue to keep the positive outlook that Atlantic Canada has in the global community.
Residents are hoping the situation in New Brunswick is a blip on a pretty COVID-clean record, and that they can return to the relative security of the Atlantic bubble sooner rather than later. Kayla Hounsel, CBC News, Halifax.
In Saskatchewan, there's been a dramatic increase in cases over the long weekend.
Cases with contact to a known case or mass gathering are increasing from 53% in the first week of October to 70% this past week.
So starting Friday, private gatherings in homes will be limited to 15 people. The active case count is the highest it's been since early August, 238. Now, science is racing to beat COVID-19, but it's hitting snags. Today, a trial for an experimental treatment was temporarily halted, right on the heels of a vaccine trial that was paused. Christine Burak shows us it's a sign researchers are being careful, as they should be.
It's unsettling, but not unusual. A clinical trial testing an antibody treatment in hospitalized COVID-19 patients has been paused. The drug company, Eli Lilly, is offering few details. Reportedly, there's a potential safety concern. The treatment offers the body manufactured copies of human antibodies to help fight this coronavirus.
I'm going to send it to everybody.
The U.S. president received a similar experimental therapy. The antibody trial is now being delayed, just a day after Johnson & Johnson announced a volunteer in its COVID vaccine trial is sick. That drug maker has also paused its clinical trials, saying it needs to learn more about the unexplained illness and whether the patient was injected with the vaccine or not.
We still don't know whether it's the placebo arm or the vaccination arm. We're letting safety protocols follow proper procedure here.
I don't know the details of the reason why the trial was paused, but they'll be looking at that data in more detail.
About a month ago, another major vaccine trial was halted. AstraZeneca and Oxford University saw 2 participants fall ill after receiving another potential vaccine. Both had neurological problems. The trials have since resumed in most countries except the United States.
It doesn't mean that it's not good. It just means that it needs to be looked at.
Scientists say if a pattern of side effects or illnesses begins to emerge, there could be cause for concern. But no one has seen anything like that yet.
I'm sure people will resume the trial as soon as they are satisfied that patient safety isn't compromised.
And once they're sure it's safe, scientists still need to figure out if the treatment or vaccine actually protects people from the virus. Christine Burak, CBC News, Toronto.
Now, we have infectious diseases specialist Dr. Lenora Saxinger joining us now because, Dr. Saxinger, in the context of a safety trial, I understand that these kinds of things will come up. And yet, it is hard not to be alarmed, right, by these unexplained illnesses. So how do we reconcile these two things?
Well, we have to remember that there's a lot of people being watched very closely in a trial. So thousands of people might have received vaccine and placebo. And out of thousands of people, we might expect someone to get a significant illness along the way. And the most responsible thing to do is to actually pause and try to figure out whether or not this event is related to the vaccine or not, whether the person even received the vaccine or not, and then decide accordingly how to proceed with the trial. So to me, it means the system is working and that the system is doing what it needs to do in terms of safety.
But how concerned are you that the effect of all of these pauses may be to have people sort of second guess whether they're willing to take the vaccine once it's available?
Well, I guess we usually don't have the entire world staring at the results of vaccine trials, but this is not unexpected. And I think that really, if anything, it improves my confidence in an eventual vaccine because it's being tested appropriately and they're doing the right thing.
Okay, Dr. Saxinger, we'll leave it there. Thanks so much for joining us.
You're welcome.
And we are keeping track of the progress of all the major vaccine candidates for COVID-19. You can check it out yourself at cbcnews.ca/vaccine tracker.
There is never really a good time to make healthcare cuts, but today, mid-pandemic, Alberta announced thousands of people will lose their jobs. Jenny Russell has the details.
Our members are preparing for strike to protect jobs.
Alberta's largest union is angry that as many as 11,000 healthcare workers will lose their jobs to save the system up to $600 million a year. It's part of an aggressive cost-cutting plan. Most of the jobs in laundry, cleaning, food, and laboratory services will be outsourced to private corporations.
They're considered heroes for helping Alberta get through this pandemic, and now they're being told that once that's over, thanks very much, but you're going to be out of a job.
Health Minister Tyler Shandro stressed there will be no layoffs of frontline clinical staff, such as nurses, during the pandemic. But the United Nurses of Alberta says it was told today that at least 500 nursing positions will be eliminated. And when pressed, Shandro wouldn't rule out further nursing layoffs when the pandemic is over.
AHS can't achieve savings, and those savings can't be then reinvested into improving the system for Albertans without changes to its workforce.
Shandro has been engaged for months in a bitter public dispute with doctors and unions. Some health policy experts say any plan is unlikely to succeed without collaboration.
Historically, it's been very difficult to bludgeon any major group in the system into large-scale change. So if you think you're in a position to win battles that no one has won before, good luck to you.
Opposition NDP leader Rachel Notley says such deep cuts make no sense, especially right now.
It is reckless, it is irresponsible, and it is a clear example of abandoning the needs of Albertans who care and rely on our healthcare system.
The province's health authority previously warned there could be protracted labor turmoil. On Tuesday, unions representing nearly 90,000 healthcare workers said they are consulting their members about potential job action. Jenny Russell, CBC News, Edmonton.
An Indigenous BC man's fight to clear his name began in the province's top court today. Philip Talio blames his situation on bad legal advice and questionable police tactics. Briar Stewart was there.
Nearly 4 decades after Philip Talio first pleaded guilty comes his appeal.
It is the culmination of many, many years of work, and for Philip, over 37 years since his conviction. So it is a very, very big day.
Back in 1983, 17-year-old Talio was charged with the death and sexual assault of his 22-month-old cousin, Delavina Mack. He pleaded guilty to second-degree murder, but since then, he's maintained his innocence. Just over a decade ago, Talio's case caught the attention of a group of law students at UBC who were focused on instances where there may have been a wrongful conviction. One of those students is now spearheading his appeal. The defense claims that back then Talio was given bad legal advice and he didn't understand he was pleading guilty. His team says they will introduce DNA evidence which they believe shows others could have committed the crime.
It's quite unusual to have a case come back before the courts after 4 decades.
This lawyer, who's not working on the case, says investigations are not always exhaustive.
New evidence does get discovered, new witnesses do come forward that weren't spoken to at the time. And whether or not that evidence will carry the day in this particular case will be up to the court.
Family members of Mack were in court today as the Crown argued that Talio had the intellectual capacity to know what it meant to plead guilty back then. But his supporters say this appeal is a long time coming.
He's doing good. Says the truth is finally going to come out.
The hearing is expected to last a month, and it will be up to the court to decide whether his conviction was justice or the miscarriage of it. Briar Stewart, CBC News, Vancouver.
Turning now to the U.S. presidential race, where the candidates are in swing states tonight, each sticking to a simple message: do not vote for the other guy.
If Biden wins, China wins, all these other countries win, we get ripped off by everybody. If we win, you win, Pennsylvania wins, and America wins. Very simple.
If I tried to make a movie talking about something like this in America, you'd think I was making it up.
Biden's lead in many states has raised concerns about dirty tricks at advanced voting polls, even efforts to prevent people from voting at all. Katie Simpson looks into that tonight.
Early lines in Texas grew quickly, people waiting hours to cast their ballots.
You know, a lot of people suffered and died for our right to vote, so I'm out here, honoring that.
Vote, vote, vote.
Voting may be more difficult for some in this state who don't want to do it in person. A judge sided with the Republican governor to limit the number of absentee drop-off boxes to 1 per county, despite the pandemic.
We continue to have real concerns about voter suppression, about ways in which voting has been made needlessly difficult by lawsuits brought by Republican parties and Republican secretaries of state all over the country.
Democrats are also pointing to the long lineups in Georgia, which has also faced allegations of voter suppression, mostly affecting communities of color.
They only have 5 machines to accommodate 1,000 people.
I'm a little discouraged with how long the lines are and how slow they're moving, but the positive part is everybody's staying in line.
For many, the willingness to vote in person, even if it means a wait, is a sign of mistrust.
I'm a vote in person. I don't trust voting by mail.
Somewhere there's going to be a problem.
A problem in California. Republicans admit to setting up dozens of fake ballot boxes to collect mail-in votes, though the party denies doing anything illegal. In Virginia, a computer system crashed on the last day to register. All of these challenges present a real dilemma for voters, trying to navigate what both sides say is the most important election of a generation. Katie Simpson, CBC News, Washington.
Twitter says it is aggressively shutting down attempts to manipulate voters on social media, similar to 2016. Over a dozen fake accounts purportedly from Black Trump supporters have suddenly appeared and then vanished, proclaiming messages like, "Yes, I'm Black and I'm voting for Trump." One that falsely claimed to be a Black Pennsylvania police officer racked up 24,000 followers before disappearing.
Now, the U.S. continues to hold top spot in COVID-19 cases worldwide. It has more than 7.8 million confirmed cases, but India isn't far behind, followed by Brazil, then Russia, with 1.3 million positive tests. That country actually set 2 grim new records today. More than 13,000 cases and 244 deaths in a single day. Here's Chris Brown with the country's plan to deal with it.
In Moscow, roughly 1,000 people a day are being hospitalized for COVID. Even for a city of 13 million, that's a lot. While strained, the healthcare system in the capital does appear to be coping. Unlike in some regions where many workers have picketed over pay and lousy work conditions. Ekaterina Yashiva from Vladimir, north of Moscow, said, "I'm supposed to administer oxygen to patients, but there isn't any." You could wait 45 minutes for the operator just to answer the call for an ambulance, said Alexander Mitrofanov, who's from Samara near Kazakhstan, and up to 3 days for it to arrive.
Every muscle of the body was in trouble.
Sergei Markov is a Kremlin-connected pundit who we've interviewed from time to time. He got COVID and is now recovering in hospital, where we spoke to him.
I think from Russian health system not financed enough. And a lot of people believe in this, and this is one of the major direction of the criticism against Vladimir Putin and so on.
What resources Russia lacks in its hospitals, it's trying to make up for in other areas. Such as new COVID-fighting technology. This scanner at the metro takes your temperature, and if you have a fever, it won't let you on the platform. There's also heavy policing of mask and cleanliness bylaws. Officers have been making sure people cover their mouths and noses, though it seems like a losing battle. They've also been dropping in unannounced on businesses. This hookah bar is looking at a $10,000 fine because staff are serving customers without masks or gloves. Even this BMW dealership got busted for not having enough hand sanitizer. For authorities, the choice was this kind of enforcement or another lockdown, and neither the government nor most Russians appear to have much appetite for that. Chris Brown, CBC News, Moscow.
Canada's top doctor says trick or treat with caveats.
Outside with the right distancing.
Up next, Halloween might not be a total bust. How to do scary safely.
Plus, Egypt is having a major MeToo moment.
Men can do whatever they want.
The women challenging the status quo.
And the national interview with Nick Nurse.
The amount of our players that shared stories about run-ins that they had with law enforcement.
The Raptors coach on Black Lives Matter, the bubble, and why he wears glasses he doesn't need. We're back in 2. Welcome back. Well, Thanksgiving's done. Time to circle October 31st, but Halloween this year has a pandemic to outmaneuver. So how should you go about celebrating safely? Well, it depends on where you live. Salima Shibji has the details.
Haunting a house is a little more tricky these days, what with all the new rules. So this die-hard Halloween fan has carefully modified his usual setup.
My kids are going to be back in the graveyard area a good 6 feet from the curb, so that'll put them about 8 feet from everyone else. But that doesn't mean my daughter's scream still isn't going to scare the everyone you know what out of people.
That's the kind of creativity public health officials are hoping to see. With this old-fashioned trick-or-treating just not possible,
here comes your candy, ready?
Candy shoots have become a thing. There are even helpful videos online on how to make your own.
So I've angled this from the stairs so the stairs are blocked off.
Social distancing kits also all the rage, and masks, already part of our pandemic routines, are being folded into costumes. Still, it's all a little unnerving for many families. 4-year-old Lillian barely takes off her costume. She's so excited. Her parents, less so.
I am a bit nervous about it. I'm nervous of trying to understand the different guidance that comes from public health officials. I'm not willing at this point to cancel trick-or-treating.
Canada's top doctor says no need to cancel as long as everyone remembers the basics.
Trick-or-treating outside with the right distancing, pre-packaging your treats so that people are not rummaging in a bowl. So there are ways to actually manage this.
But she stresses if you're in a hotspot, check with local officials, some of whom are recommending scrapping trick-or-treating altogether. Others want a more consistent message from the provinces. For now, uncertainty reigns, which 8-year-old Sam is trying to ignore.
Double excited.
As his parents prepare to make a game time decision closer to Halloween. Salima Shibji, CBC News, Ottawa.
Well, still ahead on the National, a reunion almost 5 years in the making. Their story of love and perseverance ahead.
But first,
we realized we actually have a shot at finally getting a serial rapist and predator in jail in Egypt.
Egypt's MeToo moment, the women fighting for change, next.
A trial began in Cairo Saturday that is forcing Egypt to reckon with its attitudes towards sexual violence. This man, a former student, is officially charged with indecent assault against 3 underage girls. But other women, too, have come forward on social media saying he attacked them as well. As Margaret Evans shows us, the case could indicate real change in a country that knows what it's like to step towards transformation and also what it's like to be hauled back.
In Egypt, truths long submerged have been rising to the surface.
I was 11. I didn't understand what was going on. I let him do what he was doing.
There was also a lot of manipulation involved, a lot of, but look at what you're wearing.
Egypt is a country of 102 million people, nearly half of them female. In a UN survey in 2013, 99% of Egyptian women polled said they'd experienced some form of sexual harassment. But the arrest this past summer of a privileged young man accused of raping a number of women has led to hopes that something is indeed shifting in the land of the pharaohs.
We at first just wanted him to admit it, that he did these things.
Sabah Odir was one of the first to start posting warnings online about the former university student after hearing stories about him from friends. It set off a tidal wave. Another account, called Assault Police, encouraged women to share their stories anonymously.
We realized we actually have a shot at finally getting a serial rapist and predator in jail in Egypt that has money and in power.
Odir is a writer and poet. She left Egypt for the United States last year after she herself was sexually assaulted. It wasn't until Zaki's accusers started speaking out, she says, that she felt able to tell her own story, abused by a friend.
This is a lifestyle that they've lived with forever, where men can do whatever they want, and they can call you a slut or a wife, depending on how they feel about it.
Challenging the status quo in a socially conservative and autocratic patriarchy can be both difficult and dangerous. Abusers hiding in the weeds of so-called morality. The victims almost always blame.
It will be like, oh, he's bad, but you're also wrong. And goodness, you don't want to be wrong, and a woman in the Middle East, because you're not forgiven for being wrong. It's like you don't make mistakes. You're born a mistake, and that's really it.
Tahrir Square in 2011, the epicenter of Egypt's Arab Spring. Protesters demanding the fall of former Egyptian strongman Hosni Mubarak. They were heady days, the country balancing on the edge of a potential new dawn. But in the crowds, women were being assaulted, surrounded by groups of men and groped by penetrating hands. That doesn't count as rape in Egypt. Activist Mozen Hassan dedicated herself to helping the victims.
We don't have a definition of sexual violence. Until now, the definition of the rape is just about the penetration, so anal rape, rape by sharp objects. Oral rape is not a rape.
The online avalanche of women speaking out has been called Egypt's MeToo movement, and there are signs the Egyptian government is feeling some pressure. The parliament has passed a bill to protect victims' identities. Lawyer Nehad Abu Komson points to another rape case authorities are investigating after allegations appeared online.
To have a case 6 years ago and public prosecutor open investigation in this case, this is completely new in the judiciary system at all. That's why I believe it is paradigm shift.
But as is so often the case with authoritarian regimes, one hand gives while the other takes away. Cairo's Fairmont Hotel rises from the banks of the Nile like a giant wedding cake glinting in the sun. Allegations that it was the scene of an alleged violent assault in 2014 were brought to light by the Assault Police account in July. Up to 8 men have been accused of gang raping a young woman and passing videos of it around. As in the Zaki case, they were wealthy men from influential families.
I knew 2 of these guys, so I was like very triggered, and it kind of just reminded me of my own incidents.
Raghia Mustafa is another Egyptian woman living in self-imposed exile, now in Mexico City. Her molestation at the age of 11 by an older friend who she later became involved with is just one instance of abuse she speaks about.
And he has all these screenshots that he's using against me. Like, she can't say I groped her if she did this consensually later. No, it's like, no, man, I can. Because I was a kid, I didn't understand. And the fact that it took me 12 years to realize what you did to me is scary. It means it was really traumatic. But he won't acknowledge that. And instead he chose to threaten my parents.
Parents often fear the impact of any suggestion of impropriety on a daughter's future, not just from a judgmental society, but from the state. Authorities have arrested 5 of the suspects, again from wealthy and influential families. But they also arrested some of the witnesses, using images from their phones to charge them with abusing Egyptian morals. One young woman subjected to a virginity test.
It's insane how much power the government has. The fact that the government can just arrest rape victims and witnesses to a rape just like that on no premise, and no one can do anything about it.
New cybercrime laws are also being used increasingly to target and jail female social media influencers. Some have been given 2-year jail terms just for dancing on TikTok. Egyptians know better than most just how quickly dreams of change can disappear. The Arab Spring is yet unrealized. It is a reminder of the long struggle ahead and the dangers that lurk. Margaret Evans, CBC News, London.
Next on The National, another challenge to the status quo. Nick Nurse on being in the bubble during the NBA's Black Lives Matter protests.
It has nothing to do with basketball or the job or winning or losing. It's just like, hey, how are you?
My interview with the Raptors head coach right after this.
There comes the delivery right here.
That's your delivery for you, Coach.
Look at that, man.
Congratulations, Coach.
Okay, couldn't have done it without these guys, that's for sure, right?
Well, not your average presentation, not exactly the trophy he was hoping to win this year, but still Coach of the Year, an impressive accomplishment for Nick Nurse in just his 2nd season leading an NBA team. That just part of a post-championship season filled with surprises for the Raptors, some better than others. But one thing is clear, in unprecedented times, Nurse has emerged as the leader of Canada's team.
Hey, you gotta let that fly, baby. Every one of those you got with your feet said, let them fly.
He's the man who delivered for his team and this country.
1, 2, 3.
Canada, the NBA title is yours!
Nick Nurse, now an honorary Canadian darling after bringing an NBA championship to Toronto. It was, by the way, just his 1st season on the job. The culmination of a 3-decade journey, from small towns across Europe to the minor leagues in the U.S. It was a hard road to the pinnacle of basketball, something Nurse covers in his memoir, released today. But like the rest of us, not much prepared him for this year.
The fans don't know what's going on. We don't know what's going on.
The game tonight has been postponed.
A pandemic that stopped the game, then a moment that shook all. In July, when the NBA restarted and the Raptors arrived in Orlando, the team's response was crystal clear.
Pretty tired and sick to my stomach to have to sit up here and talk about this again.
Nick Nurse has a lot to do, and there's more to come. We caught up today in the 2020 virtually.
Hello. How you doing?
So, you know, head coach of Raptors, you coach Canada's national team, your great-grandparents are from Ontario, and we're just wondering, why don't you just seal the deal and become a Canadian? 37 million of us would probably be completely cool with that.
Yeah, I think I love everything about Canada. I think that's probably in the works. We'll see what happens. So no question, I love it here.
You haven't by chance started a process, have you, to become a Canadian?
Not yet, but the conversations are started.
Oh, okay. I think still, if you ask Canadians, and particularly Torontonians, that, you know, to choose the moment of the 2019 season, you know what I'm going to say. It's you know, the buzzer beater, Game 7, Kawhi. But what I didn't realize until I read your book is how much you had going on for you behind the scenes. You had a newborn. It was like a week old. You went home to change diapers after the buzzer beater. Can you give us a sense of what that whole time was like for you?
Yeah, I mean, you know, you just kind of take it as it comes, right? That was part of my life at the time. we worked it out really good. We had Rocky on an off day, right? I think we went in there about 8 o'clock the night before the game, and I was back home about 11 a.m. the next day, and I took a nap from about 11 to 4 and went to the arena. I think it was like a 9 or 9:30 game that night, and I think we won 4 in a row after Rocky came to join us. So just taking it in stride, and you know how it is. You got to do what you got to do sometimes.
You know, this image on the cover of your book, you know, you've got the suit, you're on the sidelines, you're shouting at something or you're pacing, and then you have these glasses. And I think it's kind of an amazing and lovely story about why you wear your glasses courtside, because you don't actually need them anymore.
No, I think it was my second practice as a Toronto Raptors assistant. I got a ball flew and hit me right in my glasses. I was wearing them and they shattered all over the place. And I realized I probably better get LASIK so I don't have to wear glasses during practice on the court, because I was out there banging around with the players a little bit. And then we went to our first preseason game, and after the game, my mom was calling my phone. My sisters were calling, but my mom called, and I said, "Mom, what's the matter?" And she said, "How come you weren't at the game?" And I said, "Oh, I was." She goes, "Well, I didn't see you." And I said, "Oh, Mom, I forgot I didn't, I got LASIK, so I don't wear my glasses anymore." And she said, "You put those glasses back on so I can find you when I watch the games on television." So I said, "Okay, Mom, I'll go buy some fake ones. They're just, now I just say they're a fashion statement, but we wore them for my mom, and then we just keep it going that way."
And I'm sorry, I know you lost her earlier, but you still keep them on?
Yeah, that's just part of my, I think it's part of my my get up for a game now. So make sure she can spot me.
Oh yeah, she'll always be able to find you no matter where she is. Learning seems to matter a lot to you, and it's kind of amazing that you're in the process of getting your PhD, and I'm sure you're bracing for people one day calling you Dr. Nurse. And I'm wondering if you could tell me what your thesis is.
Yeah, I'm doing a thesis. I think it's really critical, first of all, that myself and our players use our platforms to impact our communities. And that's really what I'm doing my thesis on. Hoping to get it done by the end of the year.
Wow.
And learn a lot that I can pass on to the players, yeah.
Did any of that prepare you for 2020? Because not just the pandemic and the bubble, but you know, the horror of what happened in the United States and the George Floyd killing. I mean, so many of the players were in a lot of pain.
Yeah, and I think you got to first and foremost care about them as people. Right? It has nothing to do with basketball or the job or winning or losing. It's just like, hey, how are you? And well, how do you feel? And I was pretty shocked, really, at the amount of our players that shared stories about run-ins that they had with law enforcement, you know, like with weapons aimed at them or put to their head or whatever, you know, when they were growing up or whatever. So it's real for these guys. I mean, you know, it's really real. And I guess I probably learned that, you know, that's stories they hadn't shared with me before. And again, it brings it closer to home for you.
And did anybody have a discussion about why there are so many white coaches in the NBA? I mean, more now than there used to be. I think it's 2/3 of coaches are white. Like, does anybody wrap their head around why that is?
Well, I think that there was a lot of people discussing that. I mean, I just think that people have to be more open-minded. We have to give these guys more chances. We have to bring them, you know, I feel like part of my responsibility is to develop my young coaches. And I need to make sure they're ready to do these jobs well when they're given a chance.
Of all the things you get involved with, I was sort of half expecting you to have that jersey that says vote today, because every time I see you recently, you know, you're telling people, come on, vote. And I'm wondering, beyond the democratic duty of it, what is driving you to make this your, you know, use your platform for this right now?
Well, I think that I was looking for some way I could help and make an impact. I don't know. I just wish there was a little bit more collectiveness. It's like a team. You know, when you're coaching a team, you want your team to be together, and I wish there was a little bit more togetherness.
Yeah.
as well going on in the United States right now.
Well, listen, as a Canadian, thank you for giving us so much, so much to cheer about, and you gave us something to cheer about this year too. I mean, we all wanted a repeat, but to be excited and for it to be so close was like one of the few joys we've had this year. So thank you for that.
You're welcome.
And when we come back, they came to Canada in 2015, leaving part of their family behind.
Crying, sad, no eat, no sleeping.
But now their nearly 5-year wait is over, right after this. The pandemic has taken a toll on many families unable to see their loved ones. The Al Khalifs have felt that pain for years, separated after fleeing civil war. Then, a much-anticipated reunion was ruined by COVID-19 until now. Bonnie Allen has their story.
This is how Mahmoud Al Khalif's family spent their first 2 weeks in Canada, stuck in quarantine, unable to touch their loved ones who they waited so long to reunite with. The Syrian refugees finished their quarantine period a few days ago. And still, each hug is overwhelming for brother-in-law Abdel Karim Al-Alawi.
I don't believe this because I am very happy and excited. Yeah, I cannot believe.
These two families fled the war in Syria together and shared a home in Lebanon. Then, at the end of 2015, Al-Alawi's family got to come to Canada as government-sponsored refugees.
I like Canada. We like Canada. Very, very, very good country.
But they had to leave their relatives behind.
Our heart is broken.
His wife, Rada, was desperately missing her brother.
Crying, sad, no eat, no sleeping.
With help from churches and friends in Regina, they raised enough money to privately sponsor the Al Khalif family. It took years to process, and just when the family of 5 was set to arrive in Canada, the pandemic shut the borders.
We are very, very sad about the bad luck.
There have been plenty of similar disappointments. The Regina Open Door Society helps settle newcomers. There are far fewer this year, and helping them is more challenging.
We're always, the refugees are in our mind because they need to be in a safe place like Canada.
The Al Khalif family finally arrived in late September to an airport reunion that, due to public health restrictions, had no hugs. Then straight into quarantine. But now they are free to make plans.
They will learn English and get the job.
And free to embrace each other and life in Canada.
My brother, happy.
Bonnie Allen, CBC News, Regina.
Next on The National, never doubt the ingenuity of a bride.
I called my mom and I was like, I have this idea. What do you think about it?
When we come back, getting the in-laws together and getting married despite a closed border. Lindsay Klaus and Alex Leckie got married this weekend in New Brunswick, surrounded by family. But getting everyone to the wedding was a challenge because Lindsay's family lives across the border. Their creative solution is our moment.
I knew that there was a rule that people from the U.S. in Canada could go in a boat in the river. I kind of went with that idea and thought, well, maybe we could have a wedding and my parents and grandparents could go in a boat and like come up to the Canadian side. My mom loved it and immediately was on the phone with the mayor. He suggested that we do it at the wharf in St. Stephen. My grandparents, my aunt and uncle, and my great aunt were on a boat and came up to the wharf, and then the rest of my U.S. family stood on the U.S. side. And then when I got to the altar, I could see all my U.S. family standing on the other side of the border, waving. My family in the boat had like air horns, so they were like cheering and using the air horns from the boat. They're like, we're gonna make our presence known so everybody knows that we're here watching. I mean, the only thing I would change is that everybody in the U.S. side could have been there on the wharf with us. But other than that, it was just perfect.
So pandemic or no pandemic, it might have been the perfect spot for them. She says that when they were kids, she and her mom would drive up to a plaque that sort of demonstrated the border, and they'd joke that they were each in a different country. And it's,
Right.
it's always been a big part of her life.
And the funny thing is, the couple, they don't even live in New Brunswick. They live in Nova Scotia. They had to travel 5.5 hours to get to New Brunswick so that they could do this. So, hey, a lot of effort, and congratulations. That's all I have to say on that. That's The National for this Tuesday, October 13th. Have a good day.
Good night.